Good afternoon, everyone. Can I have your attention, please? Thank you. In school, we do this. First, I'd like to acknowledge that this webinar is taking place at Canada College, which resides on the traditional territory of the Anishinaabe and within lands protected by the Robinson-Huron Treaty of 1850. This land is occupied by the people of Nipissing First Nation. Treaty number 10 in the Robinson-Huron Treaty of 1850 since time immemorial. I'm Harriet Madigan, and I'm the host of the Village Living Well webinar series, Faces and Stories of Northern Ontario. And I'm going to introduce our guest speaker in a moment, but before I do that, we have three speakers today. Keynote speaker is Paul Preston, Melissa Ryman, and Janet Comerford. That this presentation is an opportunity to be informed and to explore an end-of-life option, namely MAID, and that it is a complex, delicate, and sensitive topic meant to provoke thought. And we hope this presentation informs, provokes thought, or prompts a very interesting, or I didn't know that. So our first guest that I'm going to introduce is Dr. Paul Preston. Dr. Preston has been a MAID provider since it became legal in 2016, and he continues to work to improve access across the North. He is currently Vice President of Clinical Programs for Ontario Health Northeast and Northwest regions. As a physician in North Bay, he practiced in the prison, long-term care, ER, hospital, psychiatric hospital, as well as family practice. He has been the chief of departments of emergency and family practice, president of medical staff and medical society, hospital medical director, and chair of the Blue Sky Family Health Team. He is a board member on the Mindfulness Council of Canada.
Yeah, thanks very much, Harriet. That was a kind introduction. So glad to see a lot of interested faces, and I wonder if I could ask some of the folks to, what they like to learn or get out of today's discussions. Anybody? Raise your hand. Updates on pre-authorizing. Yep, we'll cover that. Covering themes and all the things that I've learned from people like yourself that went ahead with a provision over the last 7 years. Oh, there we go. I hope. And at the end, I hope that we understand all the eligibility criteria of the current legislation, which is called C7, which is confusing because the first legislation was called C14, and you'd think that one would come before the other, but it was 14 first and 7 second. What the safeguards and processes are, and understand what the nature and themes of MAID are, which lady already offered one, and understand the current state and the issues and controversies of MAID in Canada. Yeah. So we'll be covering the history of MAID, like I mentioned. We'll talk about C7, the current legislation, themes and learnings, the nature of MAID and dying, what it's like to go through the process, and statistics and access, talk about the gift of life with MAID, and the 5 current big controversies and issues. Just a brief story with the real highlights. Sue Rodriguez lost her Supreme Court case in 1993, 5-4. One of the judges that voted the wrong way, according to history, subsequently said he lamented that for the rest of his life. There were multiple members' bills between 1993 and 2012. Private members' bill that did not pass, legalizing medical assistance dying. In 2012, Gloria Taylor got a constitutional exemption for MAID, and then 2015, Kay Carter's case was the case that turned the tides in Canada with a 9-0 Supreme Court in favor. It was a special ruling, means this was without any doubt. I'm sure you'd have a proper name for it, but I forget what it was. So that's how old it was. And so it started really legal in 2015 with the Supreme Court ruling. And then they gave a year for the country to come up with the legislation, which was a little more than a year, but that came with C14, which defined the reasonably foreseeable death and other safeguards. And then in 2017, Bill 84 in Ontario managed the issue with life insurance and other reporting requirements. And then in 2017, case AB in the Supreme Court of Ontario sort of really put a question mark about the reasonably foreseeable natural death requirement that was in C14 that was not in the Supreme Court ruling ever. And then the Superior Court of Quebec completely threw out reasonably foreseeable natural death with its ruling in 2019. And that brings us up to 2021, which is our most recent legislation, which was Bill C7, and where they added not reasonably foreseeable natural death, which is now we now call Track 2, and they added a waiver of final consent, which we'll go into detail as we go along. So this was Sue Rodriguez, and she asked the question, who owns my life? So she looks rather calm there, but what you can't see is that she can't speak or swallow or barely breathe, and she can't move any of her limbs. She used to get standing ovations when she went into restaurants around that time. She did go on to have a MAID by a unofficially, so-called illegally, with someone who's a prominent MAID provider to this day. So this is a person experiencing a horrific death that includes superior vena cava, where the head swells up, they become unrecognizable. I just got this off the internet, but because it reminds me of a case around 1993 that I had in North Bay. I saw a lady first present. I happened to notice a cauliflower glowing in the back of her throat. I sent her to Sudbury. It turned out it was cancer. She had had neck surgery, radiation, chemotherapy. She had tracheotomy, feeding tubes, that kind of thing. Of course, the cancer progressed and her head swelled up even worse than that. She came back from Sudbury maybe 9 months later to die. She'd had no pain. She just couldn't open her eyes. She just wanted to die as soon as possible. And she used to grab my coat every day and not let me leave, tell me, you have to help me die, you have to help me die. And of course I couldn't. Sometimes, if they have a lot of pain, you can just increasing the painkillers until they're sort of unconscious, but she didn't have any pain and she didn't want any painkillers. And she pulled out her feeding tubes, she pulled out her IVs. She wouldn't let the nurses see her. She wouldn't let the family come in, and she died. It took 7 days for her to die. And that's when I knew this was all wrong. Yeah, so the wording of the Supreme Court ruling included this, that it violates 3 parts of Section 7 of the Canadian Charter of Rights and Freedoms, the right to life, liberty, and security of the person. And they gave them a year to introduce legislation in Canada, which they missed as usual by several months. And that was Kay Carter. And this is the way it was worded. To the degree it prohibits physician-assisted death for a competent adult who clearly consents to termination of life and has a grievous and irremediable medical condition that causes enduring suffering that is intolerable to the individual and circumstances of his or her condition. So that was the basis. And you see, there's no mention there of reasonably foreseeable death. That was added by the government. This is where we are today. This is the law today. So there are 2 tracks: reasonably foreseeable natural death and non-reasonably foreseeable natural death. Primary psychiatric is specifically prohibited, and access was delayed 2 years to last March and has been extended for another 2 years. And we'll talk more about that in details. Mature minors, advanced requests, and palliative care have been sent off to parliamentary committees where they still languish, I would say. And then there's a requirement for more reporting. And so we have a ton of reporting we have to do after each provision. The eligibility changes, the C4 eligibility criteria basically are intact, except there's a track now for not reasonably foreseeable death, which you have to be 18, you have to have health insurance, so there's no medical tourism, it has to be voluntary, so we have to confirm no one's pressuring them to have MAID, and that has to be a grievous and irremediable condition, and intolerable suffering, which we need to understand and describe. So there's this comparing C14, which is the old law. People get confused because they became familiar with that one and didn't see some of the changes. So there is now an option for a final consent waiver. You can see in the 3rd row there. There is not an option unless it's not reasonably foreseeable natural death. And there's no longer that 10-day reflection period that was required in the old law. but there is a 90-day assessment period in the not reasonably foreseeable natural death tract. There's now one independent witness, which can be the healthcare worker. There used to be, couldn't be a healthcare worker, which was weird. So now we often get to staff on the floor of the hospital to be that witness, so they don't have to bring somebody else in. So this is just to discuss. So final consent waiver is a thing. It's in the new law, but it's not advance request, which someone here was talking about. So I'll just try to clarify the difference here. So a final consent waiver, normally we have to confirm that they want to proceed at the time of the provision of death. This final consent waiver waives that requirement. If they're incapable of providing that consent, they can still proceed as long as they're not demonstrating that they've changed their mind. So that is now available. The advance request, which is where you sort of say in advance, hey, if I ever get like that, I want to go ahead, is not available in Canada at this time. It's parliamentary committee, and I talked to somebody who knows the most about MAID in Canada, and she doesn't know where that's at recently. So just to dive into what the final consent waiver includes, it must be reasonably foreseeable natural death. So there's no final consent waiver if you're not reasonably foreseeable natural death. It has to have to be a scheduled date. The patient has to be informed they're at risk of losing decision-making capacity. The patient has to give consent in writing to receive MAID on the scheduled date. The practitioner has to agree, and that at the time, the patient does not demonstrate by words, gestures, refusal, or resistance to the administration of MAID. And involuntary words, sounds, or gestures made in response to contact do not constitute a demonstration of refusal or resistance. That's like reflexive tweaking from an IV or something. There's an example of the contract of a final consent waiver. So this is the C7 gains from the safeguard changes. That's the final consent waiver is a gain, the single independent witness is a gain, and the elimination of the 10-day mandatory intolerable suffering. So the eligibility gains implies that these are now a 90-day assessment period for the not reasonably foreseeable natural death. So what, like, just to give you a nice idea of not reasonably foreseeable death, those are people with chronic pain or real severe disabilities and disfigurements, that sort of thing, who don't necessarily have a progressive disease like cancer or MS or ALS, that sort of thing. And these are much more complex and time-consuming cases. So these are things that I've learned from 7 years of providing MAID and from people who are dying. The reasons people can, choose assisted death are been well known for many years. This comes out of Oregon, includes the loss of autonomy, inability to enjoy life, loss of dignity. There's this other myth propagated by those against MAID that it's due to an inadequate or a lack of palliative care, which is just simply not true. In my experience, people really fall into two camps when they request MAID. One is this existential dread, which is that they feel like they've lost control of their life and they're going to experience suffering and horrible symptoms that they don't want to, and so they have an existential dread of that, which the Supreme Court specifically called out as being intolerable suffering. And then those are always self-directed individuals. So when you go to the family and you say, "Do you think anybody's pressuring mom to have MAID?" They go, "Oh Jesus, nobody tells mom what to do." And that's what I mean by a self-directed person. Whereas with the fear of horrific death, such as hemoptysis or gross hemoptysis, where they just bleed out their mouth from lung cancer or something, or suffocation from crushing their windpipe, that captures almost anybody who's willing to try to get away from that. And the case that drove that home for me was in the first year of eligibility of after the law had referred a patient who was in the hospital with a tumor that was growing in his throat. It was a metastasis, and it was starting to crush his trachea, and nothing was working for the cancer. And he was sent back to us just to die. And the plan was that as soon as he started to feel like he was being choked to death, was just to start increasing the morphine so that he wouldn't notice it, that kind of thing. So he was really scared. And when I told him that he qualified for MAID, he just cried with great gratitude and relief. And then I followed him along. It wasn't really intolerable at that point, and he just relaxed. And his family visited. He was really enjoying himself. And week later, he was fine. 2 weeks later, he was fine. A month later, we repeated the CAT scan and the tumor had stopped growing. And 2 months later, it was still stopped growing. And 5 months later, it still stopped growing. Then he died a few months after that of metastases in his liver. And he never did go ahead with the provision because he just wanted to make sure he wasn't going to have a horrific death of being choked to death. If you can imagine being choked to death slowly over a long period of time, it's just unimaginable. So people benefit from MAID whether they have the provision or not, just by that relief and that sense of control over their lives, and that they can choose what they're going to experience or not. And they don't necessarily accept just going into a toxic delirium with medication. So they're which is really just a slow MAID because they can't drink, they can't eat, they can't really move, so they don't last longer. So the gift of life, this is just to remind everyone that organs don't have to rot in the ground with your corpse or go up and smoke with your whatever the incineration. They can be donated and save people's lives. Heart, lungs, liver, pancreas, kidneys, small bowel, eyes, heart valves, bones, and tendons and skin. So we've had our MAID donation in Nipissing has saved 35 people's lives. That was as of last year. Now we may be missing a couple there, so it's probably even higher. Pretty sure we have the highest rate of that in that province as well. So those patients, they go out like a hero. Yeah. Authoring your ending on your own terms in the presence of your loved ones, and then adding saving multiple strangers' lives is a hero's endings. Like the 2 cases that I've done that were, they're just the joy on the people's faces as they were getting the provision was just indescribable. Yeah, and the love in the room with the MAID case is so thick you can cut it with your finger. But when they're saving the lives of other people they've never even met, it's just indescribable. It's beautiful. So these are the current issues with MAID: inequitable access, religious obstruction, advanced directives, mature minors, and mental disorder as a sole underlying medical condition. So just to be clear on the last one, if you have a mental disorder, but that's stable and you're capable, and your condition with all the state of your body and mind, you're still qualified. It's when the only underlying condition is a mental disorder that is explicitly banned in Canada at this point. So inequitable access, this is provinces. You can see the best provinces are BC and Quebec by far, and Ontario, which is here, sorry, just to the right of the peak in the middle, is about half of those rates. And that's because the government is not invested in MAID programs. It has what it calls a provincial MAID coordination service, which is not a provincial MAID coordination service. It does not coordinate anything. It just refers people to areas, and many areas have no MAID providers or inadequate MAID providers. Whereas in BC, they have a provincial program. In Quebec, they have more. Most other provinces have more. So much to be improved there. And religious obstruction is causing forced transfers. That's where somebody is in a hospital or another facility like that, usually with a saint in its name, and they have intolerable suffering, and they are forced to transfer to another place in a horrible, but they're obviously suffering and very sick, or they wouldn't be qualifying, and yet they're forced to transfer out. It also causes refusing to provide information about MAID upon request. That's still going on, and they're perpetuating these myths that you can't talk to people about it. Not allowing MAID assessments on site, even in some nursing homes that also have saint in their name. Denying admission to hospice or palliative care because the person isn't interested in MAID. That is exclusionary criteria of some local hospices. Hopefully this will change through the courts as everything else with MAID changes. I understand that this is advancing. The family of Daphne Braham is advancing that as she was dying, a young woman dying of cervical cancer, was forced to transfer to have MAID and had a horrible outcome as a result. So hopefully that will change things. Though if you'd like to be involved in helping change things, you can go to the Dying with Dignity website and join in campaigning the politicians to do that. Advanced directive versus the final waiver of final consent. That was Audrey, who had cancer and brain tumors, and she was really afraid of losing capacity. So she had her assisted death earlier than she would have liked. So it's called Audrey's Amendment, the waiver of final consent. But it's illegal in Quebec. So they've been leaders, obviously, in mental assistance in dying. And somehow, if you could become a citizen of Quebec, I think you could proceed with that. Mature minors is in discussions at some parliamentary committee. Nobody knows that I know knows where it's at. You know, mature minors are able to make decisions based on whether they want anything except for MAID, as far as I know. So that you might have like a 17-year-old or a 16-year-old. They don't need the parents' permission to go on the birth control pill. They don't need their parents' permission to have an appendectomy. So I think there's more to come on that. This is the big hot topic. As you know, mental disorders is a sole underlying condition. Their expert panel made 18 recommendations. You can Google that. It's kind of well thought out. I'll just highlight 3 of the big ones. Number 5 was a comprehensive capacity assessment, which I think is totally reasonable. I think they should just define that further, because if the mental disorder is still active, how do you confirm that their capacity is complete, and that is it the disease speaking or the person that has the disease? Another one was number 6. They've all the means available to relieve their suffering. They specifically called it must include housing and income supports. So you can imagine, as a MAID provider, how do you confirm that? How do you ensure that somebody has a good trial of housing and income supports when you don't control those levers? So I think those are some of the reasons why it's been so deferred. Is it's far more complex. Many people with severe mental illness have housing and income support problems. Another one is that the person is given serious consideration to those means, and they spelled out more that this means a genuine openness and adequate information and ability to try on different options. So to try on different options, that means you've sort of trialed them, and that would mean you have to give a certain type of therapy a certain length of time to make sure it worked. And so that needs to be spelled out more. You know, 50% of the people that survived jumping off the San Francisco Bridge changed their minds on the way down. We don't know about the ones that don't survive. just because track 2 gets a fair bit of airtime here. That's the not reasonably foreseeable death. Just to give you an idea, that's the 2% that it represents that are MAID cases. Most of them are not reasonably foreseeable death. There are people with cancer and heart, failing heart and lungs, that sort of thing, that are where their death is expected either in the next few weeks or months or days or even a year. And I think you can see from my description that MAID deaths include, if you can contrast mental clarity and self-determination, they are a full score on mental clarity and self-determination, as opposed to a terminal delirium where people just give people more morphine until they're obtunded and have what we call a slow MAID over several days. So MAID is about a dying person's self-determination. It provides relief of intolerable suffering, including existential dread, while optimizing the dying role, which facilitates the completion of grief for loved ones. So it is really a gift for families. And much to people's surprise, not to ours, but to people that are trying to prove otherwise, families of MAID patients have more complete grief and less unresolved grief than families that don't. Because I can tell you, when you know you're going to die in a week or two, everybody comes, everybody. When you're not sure, maybe she's going to be a one, I don't know when mom's going to die, that kind of thing. Maybe you should come now. That just happens, and they miss it, and they don't say goodbye. They don't say thank you, and they don't say I love you. So it's incomplete. And then they carry that with them going forward. So for human beings, life is meaningful because it's a story, and the story's endings matter. So thank you very much.
Gonna have to put it on. Okay. So Paul, thank you so much. That's a lot of information. And we're going to give you an opportunity to ask questions shortly, but we have two personal experiences that Janet Comerford and Melissa Ryman have agreed to share. And thank you for your courage to do that. I really appreciate it. So just a little background. Janet Comerford is 82 years old. She gave me permission to say that. A truly young at heart, older adult who grew up with 6 siblings, all sisters, and she had the privilege of being the baby of the family. She has always been available to her family and her many friends, and she supports many organizations in our community. She's a consummate volunteer at the regional hospital, North Bay Quilters Guild, talented quilter, and much, much more. A dear friend. Janet was witness to her sister's MAID unfolding, though not present at her passing. So Janet, do you want to come and say a few words?
Thank you, Harry. Dr. Press. Carol always reminded us that she never wanted to be around for the last stage of COPD. She decided that she would have medical assistance in dying when the time came. She didn't come to that decision lightly. She had been to West Park Hospital in Toronto where they showed her how to manage her COPD. While doing those things she loved, she had a bucket list. Golfing, singing in a choir, eating, all became easier for her, helped her to live longer. She even traveled with her at Madigan and Living Fit. The group went to Mediterranean cruise to Scotland, England, Ireland, and Italy, and her last trip was Panama Canal. But she and all of us were aware, preparing for MAID spiritually and through the education and counseling she asked us to go to for grief counseling before she died. This helped tremendously. She had such courage. Carol had dealt with her illness for 15 years and lasted 4 months. The last 4 months was a very challenge. When I found out the date was set, I was home sewing, so I quilted and cried for 5 hours, still crying. The evening before her passing, we gathered with her sisters and ourselves, and we reminisced. We shared memories of happy times, kidded her about who she would meet in heaven. She wanted to see her best friend who had died long before her time. We took comfort in this. MAID was able to honor Carol's wishing, and her suffering was relieved in peace and dignity on January 18th, 2017. Carol was a pioneer. This was the first time MAID was done in a personal home by Dr. Preston, Dr. Lepper. Thank you.
So Melissa Ryman is a self-employed mother of 3 daughters, enthusiastic entrepreneur. She's driven by her passion to live and maintain a healthy and balanced lifestyle, mind, body, and soul. She's currently a sales leader for Norwex and an owner-operator of Breathe Easy Cleaning Services. She is a strong mental health and wellness advocate, graduating with honors in business administration and mental health and addictions. She is a certified yoga instructor and palliative care volunteer. Melissa hopes to help educate and spread awareness around the ongoing challenges we face with overall health and the importance of protecting our environment. So thank you, Melissa. Would you like to come and share your story?
I thought I was going to need some notes, but I will say what I have to say here just from my mind. And I just wanted to also thank Paul Preston for your presentation and your knowledge and passion, and Harriet for inviting us to speak here today. So a little bit of a brief background. I'm trying to not be too emotional. So David Jones and I were married in 2006. We were married for 8 years, and we did end up separating, although we maintained a very close friendship and amicable co-parenting relationship. Always, we were just lived for our children. I'm sure you can all relate to that. They were his world. Unfortunately, in 2019, he was re-diagnosed with cancer. He had some swelling in his lymph nodes and went to have it checked. And this is something that he had already dealt with in his late teens. When he was 18, he was diagnosed with thyroid cancer and he had his thyroid removed. So it's been an ongoing journey in cancer and checkups yearly at the Princess Margaret, never knowing if it was ever going to appear again. So that being said, we were never prepared. It was a very long 3 years of watching his decline. It ended up spreading through his other organs. He tried treatment, he tried radiation and chemotherapy, and that seemed to make him feel a lot worse cognitively, especially. And he lost a lot of weight as he was ill. A lot of the time, our daughters were going there every other weekend, so it became a lot harder for them to witness his decline. We were always communicating and trying to figure out the best way to approach this for them. And then we did not know that MAID was an option until 2021. And we both kind of discovered it. I read an article and he was informed about it, and we came together and we made the decision together and as a family to proceed. Challenging decisions were taking place with trying to figure out the time of year to be able to do it so it doesn't impact the girls as much as it should or would, which is felt impossible. We didn't want to choose a birthday month or Christmas or anything that would, put a negative and further negative impact on that particular time of their life. So we decided to go with February of 2023. However, his health declined a lot more rapidly from there. The one thing I will say positively about the decision to choose MAID was it gave him back that control and it gave him a sense of relief. And we were able to just move forward. And we even planned a celebration of life where he was able to be present. So all his loved ones, his friends and family were there. We had a little box for everyone to share their fond memories of him. And that's a book that I'm still working on creating. I feel like it's never ending to receive more testimonials and had to take a little bit of time also. And Sorry about this.
Whew.
So we took that time to celebrate Christmases together, birthdays together, everything we could to make things special as much as we could. The girls really missed their dad. It was about 2 years of him not being himself. And when we were able to discuss this with them, they were very receptive and ready. And that definitely helped him feel like, okay, this is the right decision for me and for them, because it's hard to watch a loved one decline as fast as he was. I got a phone call one morning in early November, and he was having so many restless nights, panic attacks, unable to breathe. He couldn't lay down, he couldn't get comfortable. So we decided that we would proceed a lot sooner, and him and I decided that he would stay with us, so the girls could have as much quality time as possible. And he wanted me to be with him for the actual event of his passing, and he did do it at the hospital. So the last weekend there, and then on Monday, November 14th, is when it ended up being scheduled. So it was actually moved up twice, the date, because he was done. And we were ready, and we had all the closure that we could possibly get. And then the hard part, of course, is the goodbye. And it was just about being there for him and being his strength and surrounding the girls with all of their loved ones. So we were able to give him the dignity and the control that everybody deserves in this world, for sure. So yeah, I'm a very strong advocate, because I do believe that the mental health aspect of it is so important. It's huge that he was able to have that relief. It was large, and just have that relationship and closeness with everybody right until the end, and have his wishes. He didn't want a funeral. He said no triangle sandwiches for me. So we followed suit, and we were able to do everything that he desired for the end of his life. Okay.
Thanks, both of you. I think that really, and having the pictures up there reminds us that we're all human, right? Anyways, Paul, questions? Can we take some questions now?
Did I misunderstand in the presentation? Do you have to have life insurance before you get MAID?
No, it was just that life insurance can't be denied because of a suicide. Because it's not suicide. Yeah. And that they just clarified that with that legislation.
The increase in MAID have some people concerned, and there's because of their socioeconomic conditions are looking at MAID as a solution.
And yeah, and that's a great concern, and that should never happen. That's not an irreversible condition.
You're not really sick right now, but wonder if you have a terrible fall and you go into a coma and your brain is dead. And you haven't a DNR, but you're still living. Well, why can't you say, well, if this particular thing happens to me, I need help. Do you
Yeah.
understand? what
Yep.
I mean?
That's called the advanced directive, and it's currently not
And it's
not yet permitted. It is being studied. I'm no, this is a Canadian thing. So all the provinces are the same except Quebec, and it is available in Quebec.
Just aside from physicians, can other professionals administer?
Nurse
MAID?
practitioners, yeah.
Nurse
So
practitioners. And locally, how many people in North Bay offer the service.
We have five that are, five of us that are the main MAID providers in Nipissing, yeah, and then there's some, one or two in Sturgeon Falls.
So would a person have to be referred by their family physician to access the service? How does that work?
That's, yes.
Yes.
Short answer is yes. We need the medical history to confirm everything, yes.
If somebody has a massive stroke and I don't know what I should have in place to say, don't keep going. You know, a DNR, but every time it has happened in my family, they say it's not current or you've got to make up your mind. And I've got two children who think differently. And so I don't know, what do you get in place that I could have in my wallet that if it were to happen again, my husband, that I could say, this is what he wants. Because every time it happens, I don't know how to make the decision. I don't,
Yeah, so that you're talking about what's we call an advanced care plan.
yes,
That needs to be, you need to really discuss it thoroughly with
Yes.
your power of attorney for personal care.
right.
And be very explicit and as detailed as possible. If this, then that kind of thing.
Do I have to have it in writing to pass to the doctor? Just a one, not necessarily anybody.
Well, so I think we're talking about the situation where you're incapable, right? You can't
Yes.
communicate and you're dependent, that
Yes.
kind of thing. So then the decision
Is mine.
is, well, it's the power of attorney for personal care, which is the substitute decision maker, which is poorly named. It should be the surrogate decision maker. They are actually carrying your decisions and they should be informed of what your decisions would be like in that setting.
What is the timeline between requesting MAID and receiving MAID?
So, so I'll just talk about the reasonably foreseeable natural deaths, so that if people are dying commonly with cancer or COPD or heart failure, and they're just say they're in the community, you know, they'd have to talk to their primary care provider, their family doctor, and complete a Form A, which is their written request for that. And then from there, the physician would refer to a MAID provider and assessor, and they would assess them. And then assuming that they meet the criteria, the referring physician would have to complete a Form C, and then the other physician would have to make the arrangements to get the medication, which isn't just on the shelf. It has to be prepared under a hood at the pharmacies. So, the short answer is I've seen it in the community within like a day or two, and similarly in the hospital. So that's pushing it, and the stars have to align, and you have to be able to get a hold of the pharmacists, and everything has to work. And in the community, you have to get the home care nurse to be able to start the IV in time, that sort of thing. So it's mostly a logistical issue. My co-speakers were describing where they have this advanced time and they get to go to their own wake and their own celebration of life, which is often, a couple weeks out. It's amazing what people will go through in order to spend time with their family, or I even had a patient who went through hell just to witness his daughter's wedding that happened in his palliative care room at the hospital. So if that isn't the thing, then they'll be like, when you ask them, well, you could just have palliative care, and they go, for what? So then the not reasonably foreseeable, so the people that don't have a condition that's going to end their lives in the foreseeable future, that is a minimum of 90-day assessment period, and then go from there for scheduling a MAID. But again, those are rare.
Is there any, you're saying advanced thing, is there any timeline that you think that it might be coming into Ontario?
So it'll be Canada-wide when it does. Well, it's already in Quebec.
Yes, I realize.
I don't know where it's at. It's in some part of the committee. Predictable. Yeah, I'd be speculating.
In your opinion, you mentioned in your stats that Nipissing was the highest in Ontario?
The last stats I've seen, yeah,
And-
by county, yeah.
What would you think the rationale for that is? I mean, I would have assumed Southern Ontario would be more, but is there any?
But it depends. It's all this play between religious obstruction and people who are willing to proceed with it and support it. So it's that balance. Plus, we were able to just get organized in Nipissing with home care and with the hospital, and just had a lot of supportive people.
Lot of education and taken the time to put that out there. You may not say that, but I do think that the time and effort that you spend doing sessions like this and the advocacy and awareness, I think that's a big part of our numbers.
Yeah, no, yeah, I agree. At just we at every opportunity, we would try to get another physician to shadow with us so they could see how beautiful a death it is. We try to spread the word so people know about it, so that's an option for them. Not tell anybody they have to do it, but it's people need to know it's an option because you live in Canada, one of the freest countries in the world. That is almost completely, it released itself from the talons of religion and other sort of state-controlled things. So that it's determined based on a constitution and our rights to freedom. I've had hate letters, if that's what you mean, from anonymous writers at the beginning in the first couple of years. No, we have, I would say, a very small number of physicians in Nipissing that won't participate, and most of those will cooperate enough to sort of pass the puck, so to speak. And yeah, they've never given me a hard time. I'd be ready for it.
She's going in for surgery at 10:30. Her father-in-law is scheduled for MAID on Wednesday. I got a text from her moments before I came in today to say they've rescheduled MAID for tomorrow, half an hour after her surgery. So her husband is with his father, has been there for days. And now, how do you make that decision? Who schedules it? Can you reschedule it? He's already waited 5 or 6 days for MAID, which was scheduled for Wednesday. So he actually stated that he opened his eyes and said, I want it on Wednesday because I want to spend more time with my family.
Mm-hmm.
And then he said that he was going to fight in the war right after it. So, is he making, is he lucid? Who's making the decision? And how much leeway do you have? It's just.
Like on picking a date?
Yes, to
so
make a decision. Do you have a Tuesday, Wednesday? Who makes those decisions and what kind of timing? Who's available to administer it and how much notice?
Yeah, so it's just a mutual decision between the patient, the family, how they want it, when they can get there, who the patient wants to be in the room with them, and the provider, and the provider's ability to muster a team and get the medication prepared. So it's it totally can be deferred. You just have to get the family to speak to the provider and say, well, yes, yeah. I mean, if he's not, if he's, well, the patient, if he's capacity is issue dependent. So he may be capable of saying, I want it in 2 days, not 1 day, or he may not be able to say, I want MAID kind of thing. Do you know what I mean? He may be able to spend $10, but not manage $1 million portfolio. So it's a issue dependent. So generally speaking, if he's saying a different date, then the provider would just change the date, and as long as that was technically feasible with all the organizing the care and the nursing and the pharmacy.
To finish off, first of all, thank you for your attention, and thank you to Paul Preston, Dr. Paul Preston, Janet, and Melissa for taking the time to be here today to educate us and inform us and maybe inspire us somehow. So I hope you think about exploring some more and asking some more questions and going to some of the tools that Paul has mentioned, the gift of life, dying with dignity, being mortal, some of those, and, a conversation with your family, how they feel about things like this. I got to have that conversation myself. So this has been very informative and a huge exploration. I call this avventura. It's an Italian word for adventure. Make your life an adventure, and ask some more questions. Thank you so much. Thanks, everybody.